हेलो फ्रेंड्स, आज हम रिकॉल करेंगे आईएनआईसीटी में 2026 का सर्जरी का क्वेश्चन पेपर। क्वेश्चन नंबर 1, विच ऑफ द फॉलोइंग फीचर्स बेस्ट डिस्टिंग्विशेस स्मॉल बॉल ऑब्स्ट्रक्शन फ्रॉम पैरालिटिक इलियस? ए एब्डोमिनल डिस्टेंशन, बी कॉलिकी एब्डोमिनल पेन, सी टैकिकार्डिया, डी वॉमिटिंग। इसका आंसर है बी कॉलिकी एब्डोमिनल पेन। क्वेश्चन नंबर 2, विच ऑफ द फॉलोइंग इज नॉट इंक्लूडेड इन द लीथल ट्रायड ऑफ मैसिव ब्लड ट्रांसफ्यूजन? ए हाइपरकैलेमिया, बी हाइपोथर्मिया, सी कोagulopathy, डी हाइपोनेट्रीमिया। इसका आंसर है बी एंड सी बोथ, हाइपोथर्मिया एंड कोagulopathy। क्वेश्चन नंबर 3, मैच द क्लिनिकल कंडीशन विद द मोस्ट अप्रोप्रिएट इन्वेस्टिगेशन। इसका आंसर है ए पैनक्रेटिक स्यूडोसिस्ट, सीटी स्कैन, थायराइड नोड्यूल, एफएनएसी, प्रोस्टेट कैंसर, पैट स्कैन, ऑब्स्ट्रक्टिव जॉन्डिस, एमआरसीपी। Question number 4. A patient with a thyroid nodule undergoes FNAC which suggests a follicular neoplasm. What is the next step in management? A. Total thyroidectomy, B. Hemithyroidectomy, C. Radioactive iodine therapy, D. Repeat FNAC. इसका आंसर है B. Hemithyroidectomy. Question number 5. According to the American Association for the Surgery of Trauma colon injury scale, a colonic laceration involving more than 50% of the bowel wall circumference without complete transection is classified as A grade 2, B grade 3, C grade 4, D grade 5. इसका आंसर है B grade 3. Question number 6. A prostatic biopsy reveals a Gleason score of 8, 4 plus 4. What is the corresponding grade group of the tumor? A grade group 2, B grade group 3, C grade group 4, D grade group 5. इसका आंसर है C grade group 4. Question number 7. The principle of total mesorectal excision in rectal cancer surgery is A. Excision of only peritumoral fat, B. Removal of the entire mesorectum as a single intact unit, C. Routine removal of pelvic autonomic nerves, D. Ligation of the internal iliac artery. इसका आंसर है B. Removal of the entire mesorectum as a single intact unit. Question number 8. According to ATLS guideline, arrange the following steps in the correct sequence of trauma management. इसका आंसर है बी. फर्स्ट आएगा डी कैटास्ट्रॉफिक ब्लीडिंग कंट्रोल, देन ए एयरवे विद सर्वाइकल स्पाइन प्रोटेक्शन, देन बी सर्कुलेशन विद हेमोरेज कंट्रोल, देन सी डिसेबिलिटी असेसमेंट. क्वेश्चन नंबर 9. A 60-year-old patient presents with pruritus and obstructive jaundice. On examination, a palpable non-tender gallbladder is noted. What is the most likely diagnosis? A. Carcinoma head of pancreas, B. Cholelithiasis, C. Cholangiocarcinoma, D. Gallbladder carcinoma. इसका आंसर है A. Carcinoma head of pancreas. Question number 10. Assertion: early blood transfusion in patient with hemorrhagic shock is beneficial. Reason: blood transfusion increases oxygen delivery to tissue by increasing hemoglobin concentration. इसका आंसर है A. Both A and R true, and R is the correct explanation of A. Question number 11. A trauma patient is assessed using the Glasgow Coma scale. The patient localizes to pain, produces incoherent sounds, and opens eye only to painful stimuli. What is the GCS score? इसका आंसर है A9. Question number 12. During laparoscopic cholecystectomy, achieving the critical view of safety requires adequate dissection of the cystic plate. What is the minimum length of cystic plate dissection required? A 2 cm, B 4 cm, C 1 cm, D 1.5 cm. इसका आंसर है A 2 cm. Question number 13. A 55-year-old patient presents to the emergency department with abdominal pain, distension and vomiting, suggestive of intestinal obstruction. Imagine confirms a diagnosis of cecal volvulus. Which of the following risk factors account for 50 to 70% of cases of cecal volvulus? का आंसर है A. Previous abdominal surgery. Question number 14. A 65-year-old male with diabetes presents with purulent discharge per rectum and is diagnosed with a fistula in ano. He is planned for surgical management. Which of the following is a sphincter preserving procedure? इसका आंसर है A and B both, lift and Filek. Question number 15. What is the main electrolyte abnormality underlying refeeding syndrome? इसका आंसर है D, hypophosphatemia. Question number 16. In laparoscopic inguinal hernia repair, what is the minimum distance of dissection below the inguinal ligament to adequately expose the myopectineal orifice? इसका आंसर है 2 cm. C. Question number 17. Assertion: always examine the superficial inguinal lymph nodes in a patient presenting with testicular or scrotal swelling. Reason: lymphatic drainage of the testis is to the superficial inguinal lymph nodes. So answer is C. A is true but R is false. If you like this video, please subscribe my channel. Thank you so much guys.